Thank you very much for inviting me. Home video telemetry is something very close to my heart. I'm very passionate about it. And so we did a project at Chelsea. The service is quite new anyway in Chelsea. It's solely based on a pediatric population, and it's diagnostic only. So just a bit of background to start off with. So I was a trainee registrar at King's. And King's is as we all know, is the pioneer for home telemetry in the UK. The concept was introduced by Dr. Brunhuber in 2005 at Wadham College in Oxford. Then it underwent a developmental phase between 2005 and 2012 when the service was rolled out. It was specifically targeted towards patients with severe disability who are unable to leave home or nursing home. Or with severe learning difficulties where a new environment or people are very unsettling and several attempts at admission have failed. Or there could be some specific indications if someone is on special dietary needs or seizures only occur at home and it's very difficult to capture these seizures outside. Also, home telemetry, we cannot do any drug reductions because of safety issues. So the development since introduction, the popularity continues to increase, and several other factors have to be taken into account now. We frequently lose hospital beds for winter pressures or anything else, where urgent cases take up the beds and telemetry suffers. There has been admission difficulties due to social factors as well. Parents could be single parents with multiple siblings, and they can't always come in with one child. And also patient's choice. Some people can't take time off work. So what does it encompass? It's, again, specifically applicable to children and people with severe learning difficulties or disabilities where home environment is actually well kitted out and can actually be better than hospital. It's a patient-specific thing, which a typical hospital setting cannot provide. This serves a dual purpose of providing a service in the community as well as financial savings for the trust. And we know NHS is under dire debt at the moment. And also the nice thing about it is there are residential schools and community rehabilitation centers where you can have an MDT meeting between the psychiatrists, between the community pediatricians, and make an instant decision rather than having to wait for the reports to come back from the trust or anything like that. And going to the savings, NHS savings, this is what it is. So you can see the inpatient telemetry versus the home telemetry. We get a flat rate tariff of 2,200 per patient. That is whether it's a day case, whether it's an inpatient or home telemetry. The hospital admission per day is £300 per patient. And even if we include transport, technician time, consultant reporting time, it still comes to less than inpatient costs. And that generates a surplus of 1,117 versus only 561 for inpatients. So we did our home telemetry audit. It was a retrospective study covering 8 months between April 2017 and November 2017. Our patients' numbers were 22. It was pediatric only, as I previously mentioned. They were all admitted for diagnostic purposes or assessment of seizure load. So the events captured or the diagnostic query answered were only in 10, which is 48% of the population. Suitability for home telemetry, 11 patients, which is 50%, were considered suitable for home telemetry. 1 patient was deemed purely for inpatient due to child protection issues and neglect. So, surprise, surprise, the main causes for home VT, not surprisingly, was autism and learning difficulties. Some patients were very anxious, very unsettled, even unsafe. One of them was trying to climb up out of the window or something like that. One had special dietary needs with swallowing difficulties. It was very difficult to get that particular type of food. I can't remember exactly what it was, but it was hard. Disturbed sleep with constant interruption. This is a very crucial thing. Now, nurses have been constantly advised to monitor patients' vital stats throughout the night. Blood pressure, SATs, pulse. Now, we have been asked, the reason people are brought into hospital, as we all know, for telemetry is to have an uninterrupted sleep, We need to capture the good sleep cycle, whether we have the correct sleep cycling, events which come out of, like seizures which come, or events, whatever, it could be sleep related as well. So if we don't get that uninterrupted sleep, it's very difficult to have a diagnosis. However, this often gets lost in translation, and patients are being kept away constantly to monitor vital stats. Severe disability or cancelled admissions, as previously mentioned. So the results: home VT is suitable for most diagnostic patients. It's especially suitable for people with severe learning difficulties and disabilities, where the home environment is more suitable than the hospital. And social issues leading to failed admissions should also be taken into account. Thank you very much.